Welcome back, viewers. Thank you so much for tuning in, and welcome back to my channel. My name is Patrick Tawayama Tope. On this channel, I do deliver content on social work as well as social care in general. I just want to put a disclaimer to say the topics that I do deliver on this content, it doesn't necessarily mean that I'm a guru or I know these things quite well or I know these things more than anyone else. It doesn't necessarily mean that. These are just nuggets which I share from my own professional experiences as well as interaction with people around me and from my own self-directed learning as well. However, if you want information or if you want support specific to your needs, please do contact your local support services, including your GP if you are suffering with mental health, for example. In today's topic, I'm just going to be talking to you about the 10 myths or 10 misconceptions surrounding mental health, and I hope by delivering this topic today, it will help someone who might have been holding such kind of myths or such kind of misconceptions as well, because I'm going to dispel some of those misconceptions in this video today. First and foremost, I need to mention that some of these myths or misconceptions surrounding mental health, they do persist despite increasing awareness and research around mental health. But they always persist. Sometimes it's out of ignorance, really, which is the reason why a topic like this today is going to help you to have a better understanding of issues around mental health, really. First and foremost, the common misconception is that mental health problems are uncommon, or they are not that common among the populace or among the population. Contrary to belief, the World Organization actually indicated in a report, I can't remember, I think it's a report from 2022 or 2023, if I'm not mistaken, which actually indicated that 1 in 4 people in the world will at some point be affected by mental or neurological disorders at some point in their life. 1 in every 4 people. So if you're a family of 4, it means possibly 1 of the 4 of you might be affected by mental health or neurological disorders at some point in their life before they possibly pass on. So that's an important fact to remember. That's an important statistic to remember as well. And the other statistic, which was released by World Health Organization, also you can go and Google this, online. It's information which is there online. Is that currently there are more than 450 million people worldwide who are experiencing, mental health condition in one form or another, which actually indicates that mental health or mental disorders is a leading cause of ill health and possibly disability among the many people within the population or in many countries the world over, really, to the extent that some of these mental health challenges can lead to someone to actually lose their job and not be able to maintain a job, or continue to suffer with continuous ill health, which may impede them from working for themselves, for example, and then fall back onto social safety nets presented in many different countries. That's point number 1. So it's not to say mental health problems are uncommon, but they are very common. Remember, sometimes you can't even tell that somebody has got mental health issues. Somebody is presenting with low mood, or somebody is presenting with depression. Sometimes you can't tell. Somebody might appear outside to be doing well, but deep down they are actually dying, emotionally or dying mentally in terms of their own mental health. So you can't generalize that it's uncommon. It is quite common, and obviously start to say 1 in every 4 people will suffer mental health or some neurological disorder of some form at some point in their lives. Point number 2, the other misconception is that panic attacks can be fatal. While panic attacks can be incredibly distressing to the individual who is suffering them, or to other individuals who are witnessing them, sometimes it doesn't necessarily mean that they directly cause death or that directly cause someone to be in a situation where they might actually lose their life, but it doesn't necessarily mean it doesn't happen, so to speak. So for someone experiencing panic attacks, it might be, they might be prone to accidents, and then those accidents may be the ones that may cause death, or that may cause significant injury or harm to them, really. So it's important that when somebody is having panic attacks, it's important to encourage them to find safe space, so that it can help them to mitigate that risk. Because if they're not in a safe space, it means that they are prone to accidents, or they are prone to injuries, which might actually cause significant harm to them. Point number 3 is that, or the common myth, or the common misconception, is that mental illnesses implies low intelligence, or people think that people who suffer from mental health, they've got low intelligence. It doesn't necessarily mean that, because mental health or mental illness affects people regardless of color, creed, race, or level of intelligence, social class, or income levels, or we are poor or we are rich. It doesn't matter. Mental illness, can affect people regardless of all those connotations which I mentioned earlier on. Just like physical health condition, mental health issues can impact anyone at any point, at any given time as well. So it's important to actually take note of that. Point number 4 is that the other common misconception is that you only need to care for your mental health if you have a diagnosed condition. This is totally wrong, and it's untrue as well. Taking care of your own mental health can actually help you to prevent you from having a mental health condition. Taking care of your own mental well-being is essential, for everyone, basically, not just those with diagnosed conditions. Because remember, they always say prevention is better than cure. So prevention and self-care benefits everyone. Prevention and self-care benefits everyone. I'm repeating that again. Point number 5, another common misconception is that people with mental health issues are unlikely to recover. Or once you are diagnosed with mental health, then that's it. It stays with you forever. Some conditions, yes, they may be lifelong, but some of them may not necessarily be lifelong. Some can be treated and then you can be out of that condition. For example, depression, you can be depressed for a couple of months or few months, but then down the line, you can recover your mental health and you'll be fine, as long as you adhere to what the mental health professionals are actually recommending that you need to be doing. You will be fine, possibly towards the end of the day. So I think I need to stress that mental health issues can be treated. Some of them can be treated, and people can make a full recovery from them, leading happy and fulfilling lives. I know I've got people close to me who have had mental health challenges as they were growing up, but now they are totally fine. No issues going on for them, because they've adhered to medication, they've adhered to the treatment which they were putting, and they adhered to any advice that they were getting from their mental health practitioners, and things are actually moving on fine for them, as well as some few colleagues that I've worked with as well. Point number 6 is that you can tell if someone has got a mental health issue by looking at them. This is fundamentally a myth and wrong and a stupid misconception, I would say so, because mental health conditions are not visible. They're not like a wound which is on my arm that you can tell that there is a big wound on your arm or on your forehead. Mental health is not like that. It's not that visible. People experiencing mental health illnesses, sometimes they may appear the same like you and me or like everyone else. And it's important to avoid such kind of misconceptions, or to avoid such kind of assumptions based on appearance of somebody. Or if you see somebody in the street looking dirty or unkempt and all that, you generalize that they are suffering from mental health. Sometimes it doesn't necessarily mean that. Sometimes it's just because they are poor, they don't have soap, or they don't have a change of clothes or stuff like that. You've seen videos on YouTube, on TikTok, where somebody who has been in the street looking scruffy and unkempt, who might pose like as if they've got mental health issues, when they get a real makeup, they will be a changed person altogether. So it doesn't necessarily mean that you can tell that someone has got mental health by merely looking at them. Point number 7, another misconception is that people with mental health issues are violent and dangerous. Yes, to an extent, some of them may be violent, some of them may be dangerous, but in reality, individuals with mental health problems are statistically more likely to be the victims of violence rather than the perpetrators. That's what statistics says. So, we need to be mindful about such issues. If you go on a website called www.mentalhealth.org.uk, you can actually find this assertion where they've actually made it clear that in reality, individuals with mental health problems are statistically more likely to have been victims of violence rather than perpetrators. So I think it's important to be mindful of that rather than making misconceptions. Point number 8, young people do not experience mental health problems. This is a fundamentally flawed way of thinking if you think like that. Well, otherwise wouldn't have had comes actually if you would think like that, because statistics from WHO indicates that approximately 20% of adolescents may experience a mental health problems of some form at any given in a given year. So 20% in a given year may be experiencing some form of mental health in a given year. So it's really, really essential to make sure that you recognize and we kind of support the young people who have got mental health issues, to make sure that their mental well-being is actually taken care of. Point number 9 is saying another misconception says nothing can be done to prevent mental health. I remember I mentioned in the previous video that prevention is better than cure, or I think it was the same video where I mentioned that prevention is better than cure. So it's important to point out that prevention involves various factors, really, which includes, strengthening your social as well as emotional skills, seeking early support, early intervention when you start to feel that things are not okay, taking care of yourself, taking time off work, and all those kind of things, where you develop, positive relationships with your friends and family, and maintaining good physical health, which are all preventive measures that you can take to make sure that you actually take care of your own mental health, really. And then point number 10, another misconception is that mental health is separate from physical health. This is totally untrue, because there is a link between your own physical health and your mental health. If you don't take care of your own physical well-being, your mental health suffers as a consequence. Or if you don't take care of your mental health to an extent, your physical well-being also suffers as a consequence. So mental health it's kind of interconnected, really, with physical health. Taking care of both aspects, it's actually will ultimately contribute to your overall well-being as an individual. And then point number 11, another misconception is that mental health issues are a sign of weakness. This is totally untrue and, fundamentally wrong to actually say that, or to even think like that, because it's not a sign of weakness. I think the fact that you're acknowledging that you are going through some mental health issues, it's a sign of strength. It's a sign of you being somebody who is able to recognize what's going on for you. It's a sign of good self-awareness, really, so to speak. So seeking help for mental health, demonstrates strength and resilience as an individual. And it's essential to break down this stigma to make sure that this, doesn't happen, and people, are able to actually seek support when required to seek support, or when they feel that their mental health is actually declining. So it's important to understand and also dispel these myths, so that we can contribute to a more positive and more compassionate approach towards mental health, within workplaces, at home, in the society, and in your local community and stuff like that. And then if you know someone who is struggling with their mental health, encourage them to seek help, or support them to make sure that they seek help, so that we can dispel some of these stupid myths and misconceptions which are going on out there. With those few words, this is the end of the video today. And if you haven't subscribed, please do subscribe, hit that notification bell, so that when I post, you'll be the first person to know. And thank you so much for tuning in today. Thank you so much.